Hello, I'm Claudia and I'm a research officer at Nuffield Council on Bioethics. We are an independent body that examines ethical and social issues raised by biological and medical research, and we inform policy and public debate. I'm really excited to join you today to talk to you about one of our current projects focused on the role of technology in mental health care and in the future of mental health care. Project is ongoing, so I will be giving you an overview of what we're looking at and the themes that we would like to explore. But first, I'd really like to just thank Dr. Inkster very much for organizing this amazing conference, as well as my colleagues and everyone who has been or is involved in this project. So in recent years, we've seen a great interest in how technology can be used to improve mental health care and increase access to mental health support. And we are seeing a shift towards digital and remote forms of support, a shift that has been accelerated by COVID-19. So we believe that this is the right time to pause and think about the possible ethical implications that an increased or widespread use of these technologies may have for individuals and for society in the future. We're looking at a broad range of technologies, really, in the context of prevention of mental health issues and promotion of well-being, assessment and diagnosis of mental health problems, and also treatment and monitoring of mental health conditions, of course. So, for example, smartphone apps, which, as you know, can be used for different purposes. For example, for delivering psychological therapy for specific mental health conditions, or just for monitoring mood and mental well-being. Also, immersive technologies, in particular, the use of virtual reality to deliver psychological therapy. For example, we know that there is an interest right now in the development of fully automated psychological therapies to be delivered through VR. And there are some interesting projects going on in the UK. We're very interested in digital phenotyping and in all the tools that can be used to continuously collect behavioral and physiological data outside of clinical settings, such as smartphones, wearables, and other devices with sensors, and even social media. We know this data can be used to monitor mood or mental health of individuals and populations, and provide information that can help clinicians in decision-making, for example. Somehow related to this, we are also examining advancements in machine learning analysis and natural language processing, and how they can be used in the prevention, diagnosis, and treatment of mental health conditions in a number of ways. For example, they can be used to determine the severity of symptoms in psychiatric patients or to predict clinical outcomes. Lastly, we're exploring possible uses of wearable brain recording and stimulation devices, such as portable EEG or transcranial direct current stimulation. These were once used only by clinicians and researchers, and are now available to the general public. And they can be used, for example, to improve mood, but also to treat some conditions such as depression. So what are the issues that we think we should be paying attention to? I want to give you a few examples of what we're looking at. First of all, it seems likely that mental health care might become increasingly contactless and automated in the future. And this seems something that all these technologies have in common. So if that's the case, we really need to think about the effects that this may have on service users or carers. Initial studies examined the experiences of remote mental health care during COVID-19, for example, have shown that while some adapted quickly to contactless mental health support, and also appreciated the flexibility offered by remote care, others experience feelings of loneliness or social isolations and a sense of disconnection, which can make things worse or contribute to further deteriorating mental health. We should also consider whether and how this lack of human support affects the quality of care and the quality of the therapeutic relationship between patients and carers. And also, another interesting question is whether a therapeutic relationship can be formed with non-human agents, such as a chatbot, for instance. At the same time, we want to look at the benefits of interacting with non-human agents. For example, some people might prefer being cared for by a non-human therapist, as they might feel less judged or just more comfortable. Something we're really interested in is the effectiveness of technologies for mental health support. We know that concerns have been raised about the lack of scientific evidence supporting the use of some technologies, such as smartphone apps, and that there have been calls for further research in this area. An important theme for us is that of inequality and the role that technology could have in reducing and at the same time increasing inequalities. With technology becoming more affordable and available, access to mental health support could really increase. Some groups, however, such as homeless people and older adults, may not benefit from technological forms of support. Highlighted by COVID-19, increased reliance on technology can exclude individuals and communities who experience difficulties in using or accessing technologies. And so we need to make sure that alternatives always exist for them. We should also ask ourselves whether mental health information is particularly sensitive when compared to other kinds of health information. Information about person's mental health, for example, could lead to discrimination or could influence criminal justice proceedings or even justify involuntary hospitalization. So as new public and private actors collect information about people's mental health states, questions arise about their responsibility. Some technologies could involve a high level of monitoring. This is an important issue to consider, as there might be a risk of undermining individuals and public trust in mental health services and in organizations that deploy digital technologies, with implications for their acceptance and uptake. So, where we've got to. We're exploring these and other questions in different ways. We engage with a range of stakeholders, for example, through interviews. We also had a workshop earlier this year in May to hear the views of mental health professionals, researchers, and also representatives of organizations with an interest in this topic. And we're planning other engagement activities in the future. We will be publishing a policy briefing in autumn 2021, summarizing these issues. And I'd just really like to say that this is a really important project for us, and we hope that our work will be useful to a range of stakeholders and that it will inform the work of policymakers, mental health professionals, and researchers. So if you have any comments or questions, please just drop me an email. And thank you very much.